Hi guys, so we're going to talk about basically the last system here, and it's the reproductive system, and we're going to start with male anatomy and physiology. We will be talking about female anatomy and physiology in the second part of this. So let's discuss a little bit or watch this video on why this subject even matters.
Did you know that the United States has the highest rate of sexually transmitted infections among developed countries? Sexually transmitted infections, or STIs, are the most common disorders of the reproductive system. Since over 12 million Americans contract STIs each year, it is highly likely that you will encounter some of the most prevalent STIs in your patients, including gonorrhea, chlamydia, the human papillomavirus, and herpes. As a healthcare professional, it is very important to educate your patients on their reproductive health. In order to do this effectively, you will need to understand the underlying infectious agents, modes of transmission, and symptoms of the most common STIs. For example, gonorrhea is caused by a bacterium that is spread by contact with the mucosal surfaces of the reproductive system. These bacteria invade the mucosa of the reproductive and urinary tracts. Since gonorrhea is caused by bacteria, it can generally be treated with antibiotics. However, if left untreated, gonorrhea can cause significant complications like infertility in women and inflammation of the entire male reproductive tract. Having a solid understanding of the anatomy and physiology of the reproductive system will enable you to recognize symptoms of reproductive disorders like STIs, give you the ability to treat your patients with STIs, and educate all of your patients on ways to maintain a healthy reproductive system.
So hopefully that kind of gives you a good idea why this section is important. Now, when we're talking about the reproductive system in general, we're talking about primary sex organs and basically what allows us to reproduce. And those primary sex organs, known as gonads, are different for male and women. In men, they're called testes, and in women, they're called ovaries. And they both produce what's known as gametes. And gametes are basically just sex cells. So I like to say how I always remembered this is sex is a game. It's not the most PC way of saying it, but that's how when I was going through, I remembered what gametes were. Now, gametes are basically sperm and ova. Sperm being the basically sex cells that are produced in males, and ova being in females. Now, the sex hormones that help with this entire process that are produced are both known as androgen, which is the sex hormone in males, and estrogen and progesterone in females. So since we're going to start, that was kind of an overview of both. Now we're going to get more specific here in a second, but essentially there are accessory organs for each male and female. And those accessory organs that we're going to talk about in each case are the ducts, the glands, and basically the external genitalia. So now that we've kind of given a brief overview, let's go into male reproductive system, and we're going to start with talking about the testes. And so basically, the thing that produces sperm in men are the testes. Whoops. Oops. Oh, it's gone all over the place. There we go. And these can be found within the scrotum. And like I said, they produce sperm. And basically, sperm is delivered to the exterior through a system of ducts. And so if you look at this picture, I've kind of shown you basically the duct system that they start with. And so once it leaves the testes, it goes to the epididymis. You can see here. And then it's going to leave out of that and go up here to the ductus deferens, known as the vas deferens. It's the second one. From here, it'll go through here. And basically, next it's going to go into the ejaculatory duct. And then finally, it's going to go out into the urethra. Now, this is the duct system that it goes through, and there are also accessory sex glands in here that basically help with the movement of sperm through this. So you can see up here you have the seminal gland. You have here the prostate gland, the bulbourethral gland here. So those are the three main accessory sex glands that we're going to end up talking about here later in this lecture. And so let's talk about the scrotum. So this is a sac of skin and basically superficial fascia, right? It hangs outside the abdominal pelvic cavity. Let me change. It basically contains paired testes. Essentially what it is, the scrotum has this midline septum that divides it in half, and then you get each side has one testes within it. Because they're able to hang a little bit lower, they're 3%, they're 3 degrees Celsius lower than the core body temperature. And the lower temperature is necessary to help with sperm production. And so basically, the temperature is kept constant by 2 sets of muscles. The darto muscle is the first one, and this is composed of smooth muscle. And essentially, it helps to wrinkle the skin. And so what this does is it helps to pull the scrotum closer to the body. Now, the cremaster muscle is skeletal muscle. And this basically helps to elevate the testes. So these guys together will work to either make the scrotum shorter or more wrinkled. And if that happens, it'll pull it closer to the body, so the temperature will increase, or it'll become flaccid and loose to increase the heat loss when it's too warm, so it'll hang lower. So these muscles work together to allow the temperature of the testes to remain pretty much constant. So now let's look at the external part to kind of get an idea of the male perineum. And so this is the diamond-shaped region between the pubic symphysis. So this is the pubic symphysis, that's right here. The coccyx, which is back here, and the ischial tuberosities, which are here. So if you look, it's kind of that area that's right here. Which this is the reason why we talk about bone structure as well in part 1, because then it'll help you to start getting some reference points when we talk about the anatomical structure in other parts of the body. And so in this area, this contains basically the root of the penis and anus, and it also is going to, this should be down a little bit farther so you can see it, and it's the area where the scrotum is suspended. So that's if we're looking at that area just on the outside. Now, when we're talking about the testes in particular, right, this is what we find inside of that sac or the scrotum. Each testis is surrounded by some tunics. And so you have the tunica vaginalis, and basically this is the outer, and you can see this over here, right? The outer layer, and this is derived from the peritoneum, and you can see that right here. And so it's really kind of harder to see, but you can see it's pointed in there. And then you have the tunica albuginea, right? And this is the inner layer. And this forms basically the fibrous capsule of the testes. Now, there is a septa within the testes that will allow it to be divided into about 250 different lobules. And each one of these lobules contain 1 to 4 seminiferous tubules. And the seminiferous tubules are important because this is the actual site of sperm production. And if you remember earlier when I was talking about the midline septum, that's the midline septum. You can kind of see in there, right? It's also showing you right there. You can also see on here that you have basically the different muscles here, right? Shows one of those muscles there. If there's anything on there else that we've talked about yet. And here's the other muscle right here. That is talking about the scrotum and the skin. So, and that might actually help you there too when identifying what each muscle does. Now, let's kind of take a little bit of a look. We're going to, here in a few minutes, get closer into the testes so that you can see these lobules and the seminiferous tubules. But first, we're going to talk about what important cells are within the seminiferous tubules that help with the production of sperm itself. And you can see this whole picture here. This whole area right here is the seminiferous tubules, right? And so in the epithelial lining here, we're going to talk about first the separated spermatogenic cells. And these are the actual sperm forming cells. And so you can see those right here, right? The next one we're going to talk about, the sustainocytes, and you can think they help to sustain the cells there. So these are supportive cells. And so you can see those. Let me put this as 1 and 2. So this is 1 and this is 2 here. You can see them up there, right? Now, surrounding those cells are 2 different types. There's myeloid cells, and then there's the interstitial endocrine cells. So these myeloid cells actually surround each seminiferous tubule. So you'll see those right here, right? And you can see them located in this area right over here. And these are basically smooth muscle-like cells. Let me put smooth muscle-like. cells, right? So basically, they are thought to help squeeze sperm and testicle fluid or testicular fluid out of the testes. Now the last one is here. These interstitial endocrine cells, which are also known as Leydig cells. And they're located in the soft tissue surrounding. And they're important because they help produce androgens, such as testosterone, and they secrete it basically into the interstitial fluid there. And here right now, we're just looking at where they're located. Here in a few minutes, when we actually get to the physiology part, we'll talk about what all these things are and how they're important. So when we're talking about making sperm and trying to make it so that it moves around, we're going to talk about what compartment it goes to. So essentially where it starts when we make them is the seminiferous tubules. And you can see that located right here. So all these little lines that you have up here, right, are the seminiferous tubules. And if you look here, there's the lobules. So you can see the seminiferous tubules located there, and there's several lobules there, right? And so basically what happens, it goes from there into the straight tubules. So you can see the straight tubules here in this location, right over here. Those very small things that are going to connect to this larger unit here, which is called the ret testes, which is where it goes next. From here, it's going to go into these other straight kind of lines here called the efferent ductiles. And then the last thing it's going to do is go through the epididymis. Now, the epididymis actually is made up of 3 parts. It's made up of a head, a body, and a tail. And so if you look at where the efferent ductils are, you'll notice that they come in contact with the head. So it's going to go from the head down to the body to the tail. Now the sperm are actually stored in the tail until ejaculation. Now they can be stored there for several months. And basically there are these little microvilli, or also known as stereocilia. That will absorb the testicular fluid basically. From there, they will pass the nutrients from that to the sperm. And so the sperm will enter non-motile. And they will pass slowly through this. It takes about 20 days. And they'll go from non-motile to being able to move. And so during the process of ejaculation, when the sperm moves from these, basically it's going to leave the epididymis and go into this area at the top called the ductus deferens, or vas deferens is how I remembered it. So let's go on now from the epididymis area to the ductus deferens or vas deferens. And we're going to talk a little bit because this is the duct system that we're going to get into. So, the ductus deferens or vas deferens are smooth muscles. And within that, the walls that contain the smooth muscles, they can contract, which will propel the sperm from the epididymis to the urethra so that it can leave. And so if you look at this, we're going to start, if you look here, that part right there is what we were just looking at with the epididymis. So basically it's going to go from there to into that guy, which is the ductus deferens or vas deferens. Now, the vas deferens will expand whenever you come up here. So do you see that thing right there? And that's what's known as an ampule. So this ampulla will kind of allow it to basically just open and get bigger a little bit there. Now, from there, you're going to see it's going to go into this area right here, which is known as the ejaculatory duct. Now, this, if you notice, basically, get a different color here. There's this guy that's right here. So basically, the ejaculatory duct is the ampulla plus the seminal gland. And we're going to talk about what the seminal gland does here in a second. So they come together to make this ejaculatory duct. And then basically from there, they're going to go into this part right here, which is known as the urethra. Now I'm going to show you here in a bit that as the urethra goes down here to exit, that it is subdivided into several different parts. And we're going to get to that here in a second. And I'll show you a little bit. Now, there are some ways to essentially help in effective birth control, changing this duct system or cutting the duct system off. So there's what's known as a vasectomy, and this is when you're cutting or ligating the ductus deferens. And so if you cut this, it is essentially nearly 100% effective as long as it remains cut. They even have in other countries that have not been approved here, a polymer that they essentially can inject in this area, and it basically blocks the movement of sperm from here. And you can keep that until the point that you want to have children, and then they inject you with another solution that basically breaks down that polymer and allows you to have kids. It has not been approved in this country. I know they've used it in certain parts of the Middle East. I believe they've used it in India, but it hasn't been approved here for use yet. Now, when we're talking about blood supply, nutrients, and oxygen, and how everything is maintained in the testes, the arteries, the testicular arteries, basically arise from the abdominal aorta. And you'll remember this, that main area that comes out in the back. Now, the testicular veins actually rise from the papiniform venous plexus. This is surrounding each testicular artery, and it helps a lot. It helps to basically keep it cooler. It can absorb heat from the arteries, and that essentially will make sure that the testes remain cool. And so when we're talking about where these are located in, you can see it within the spermatic cord. So that is here, and you can see that it comes down, and this is what encloses the nerve fiber, the blood vessels, and the lymphatics that actually supply this guy. Now let's talk a little bit about the homeostatic imbalances that can happen to the testes. It's rare, but testicular cancer is the most common cancer in men from the ages of 35 to 50. Having mumps that leads to orchitis, that's an inflammation of the testes, could be a risk factor. Cryptorchitism is the most common risk factor on the descent. Signs of this are basically painless and solid masses in the testes. And basically, it can have a 90% cure rate by surgically removing of the testes and other radiation and chemical therapy. So testicular cancer doesn't necessarily mean a death sentence. It is completely treatable. So now let's actually look at the penis itself. So, and the overall organs. So when we look at this, the penis is the copulatory organ, right? And so when we're talking about the external genitalia, that essentially is talking about the scrotum and the penis itself. Now, the penis consists of the root and the shaft and ends in what's known as the glans penis. Now, the prepuce is also known as the foreskin, right? And this is a cuff of loose skin. So this covering here is what gets removed during a circumcision. And this is kind of interesting. It's pretty common in the U.S. About 60% of the male population in the U.S. is circumcised. But if you look at the world, it's only about 15%. So no, not as common. Now, there is striking evidence out there that says that circumcision can actually help reduce by 60% the rate of HIV risks. And it can actually reduce other reproductive infections. Now, internally, the penis is made up of basically the spongy urethra and 3 cylindrical bodies of erectile tissue. So if you look here, the spongy urethra is right in here. And then when we're talking about the 3 cylindrical bodies, you can see down here what we're talking about, right? The 1, 2, and 3. They're kind of showing you the different, and we're going to look at what these guys are made up of, right? And so these are just spongy networks of connective tissue and smooth muscle. And they're going to have some vascular space in there. Now, when we're looking at them, one part is what's called the corpus spongiosum. And so if you look, that's the guy right here, and you can see it's on this outside, right outside that spongy urethra. And you can see it down here as well when we're looking. And so you see the urethra kind of in that circle right there. And then right there in that basically 3rd circle, you can see that corpus spongiosum. And so this is the part that essentially expands to form the glands and the bulb. And you can see that down here. Now, the corpora cavernosa is right here. You can also see this in this section here and this section down here, right? In 1 and 2. And these are basically paired dorsal toward the back erectile bodies. And so these are going to help with forming the erection. And basically what happens is erectile tissue fills with blood, causing the penis to enlarge and become very rigid. Now, if you look at this right here, the crus, or what's also known as a cura, this is a proximal end of the corpora cavernosa. I'm just going to put the CC, right? And this is what essentially anchors the penis to the pubic arch. So this kind of gives you an idea of the, what's on the outside, what's actually making the shaft of the penis, and how it's connected to the body. So now that we know the structure, let's focus a little bit on the different parts of it, specifically the urethra. And I had told you earlier when we talked about it going through here, we would get into the different parts. So the urethra conveys both urine and semen, of course, at different times. It has 3 different regions. You have the prostatic region here, okay, and this surrounds the prostate. And the prostate's a gland that we're going to talk about here in a few minutes. The intermediate part, 2, of the urethra. And this basically, as you can see, it is in the urogenital diaphragm, or the triangular ligament muscle. So you can see right here that it's basically the area that is around here. And the last is the spongy urethra. And this runs through the penis. And it opens at the external urethra orifice. So you can see it basically down here, and there's that opening. So I mentioned the prostate gland, right? And so there are a lot of accessory glands that help with both nourishing the semen or the sperm, and to help move it through and give everything that it needs to work correctly. So let's talk about the male accessory glands, and we're going to start with the seminal gland first. So the seminal gland is on the posterior bladder surface. It contains smooth muscles that contract during ejaculation. And it's important because it produces viscous alkaline seminal fluid. Now that seminal fluid is going to contain fructose, citric acid, and coagulating enzymes. Perfect example of an enzyme that it has is vesiculase and prostaglandin. Now, when they're doing CSI television and they're trying to figure out, if there's blood or different kind of fluids on things, that sometimes they light up by UV light, and there's basically yellow pigment within it that fluoresces with UV light, and that's how they can pick up. And it comes from this seminal gland. Basically, this comprises about 70% of the volume of the semen. And if you remember, the seminal gland joins the ductus deferens or vas deferens to form the ejaculatory duct. So this is the seminal gland. The next one that we're going to talk about is the prostate gland. Now, the prostate gland will encircle the urethra that's inferior to the bladder. It's about the size of a peach pit, that inside part of a peach. It does contain smooth muscle as well that contracts during ejaculation. And this is going to secrete milky, slightly acidic acid fluid. Now, this contains citrate, enzymes, and prostate-specific antigens. A short for that is PSA. So what this does, it plays a role in sperm activation. And so this makes up about 1/3 of the semen volume. Now, there are homeostatic imbalances associated with the prostate gland. So let's talk about a few of them really quick. And some of you guys may end up suffering from this. I know I've had family members have these problems. So prostatitis is something that's actually pretty common. And this is overall an inflammatory disorder. It can be caused by bacterial infections, And so you can have acute prostatitis or chronic prostatitis with this, right? They put acute or chronic. And a lot of times what they do is they treat this antibiotics. Now, it's not just from bacterial infections. It can also be caused from injury, or if you have some kind of problem with an immune system disorder. So it's not just if you have a bacterial infection, it's just that that's one of the common parts. Now, chronic prostatitis, acute is something that's going to be limited and you can get over it pretty soon. If you kind of have this issue that remains in your life constantly, it goes into chronic prostatitis. And this is also known as pelvic pain syndrome. Now, they're both inflammatory and non-inflammatory types. So this guy has UTI-like symptoms. And you might ask yourself, what is that? And basically, if you've ever had one, you get pain in external genitalia and lower back. It can get it where it, like UTI symptoms, it hurts to pee. You have a hard time urinating it because it's become inflamed, so it cuts off your urethra and it doesn't go through there. And another thing that you can have is leukocytes actually in your urine. Now, the symptoms are the same as above, except there's no leukocytes or bacteria in the urine at all. So that's with chronic prostatitis. Now, there's also known as benign prostatic hyperplasia, and this may be age-related. It's basically when there's a distortion in the urethra, or this problem distorts the urethra. Sorry for my misspeaking. And so it can be treated with surgery. That's the most common type that's been used the longest, but there are newer options. For instance, they have used microwave to shrink the prostate. They've used what's known as balloon compression. And radiofrequency radiation. All of these aimed to try to allow the urethra to work, and most of them trying to shrink the prostate or make room in that area for their urethra. And the last we're going to talk about is prostate cancer. So prostate cancer is the second most common cancer. Or the second most common cause of cancer death in males. It's treated by surgery, and radiation, castration, and drugs. They have done some clinical trials to do other types of treatment, like cryosurgery, different types of chemotherapy, ultrasound, and proton beam therapy. And only time will tell if they become really, really good and a more common type of treatment for this. And the last type of male accessory gland that we're going to talk about, the third one, is the bulbourethral gland. It's a pea-sized gland that's inferior to the prostate. You can see it right over here. And basically it produces thick, clear mucus during sexual arousal. And that's important because it helps to lubricate the gland's penis and neutralizes the traces of acidic urine in the urethra to give the sperm a nice safe place to go through, right? Now, what's going to go through here? Well, sperm, of course, but sperm is part of something bigger, right? Essentially known as semen. And semen is this white milky mixture of sperm and accessory gland secretions, right? And basically, whenever we have this, men basically ejaculate about 2 to 5 mils of semen. And that semen is going to contain anywhere from 20 to 150 million sperm per milliliter. So it's going to have a lot of sperm in there, right? And that semen contains what's known as fructose. And fructose is important for ATP production. It helps to protect and activate sperm, and it's going to help facilitate sperm movement. And so this stuff, basically is an alkaline fluid. Remember that you have a couple glands that are working together to make it that way. And that does twofold. It's going to basically neutralize out the urethra in males, right? And remember, we're talking about because they use both that the urethra for the release of urine in combination with the release of sperm. So there's some urine that's left over there. So we want to be able to neutralize that out. But sperm is going to leave, and it's going to go into a cave unknown to any sperm before it. That's actually a lie, right? It happens over and over again. But it ends up going into a new place outside the body known as the female vagina. And the female vagina is acidic in nature. And so it's going to help to make that area more friendly to then enhance motility or movement. So all this is going to work together. Now there's a bunch of different characteristics of semen. And we've talked about kind of all these different things that the different types of glands produce, right? And we're kind of like, well, what's the purpose of that? And so, for instance, they have prostaglandin within semen. And so this is going to do a couple things. It's going to decrease the viscosity of mucus in the cervix, and it helps to stimulate reverse peristalsis in the uterus. So it's going to allow the sperm to be able to move around better, and it's going to allow for it to be moved up through the female reproductive system. Now, it contains different hormones. For instance, one known as relaxin. And other enzymes that basically enhance sperm motility. It has ATP. That's important for energy production, right? And we talked about it comes from fructose. It has the ability to suppress the female immune system. You have to remember, when semen is going into a female's body in their reproductive system, it's considered an outsider. So the body, under normal situations, is going to try to protect itself and start trying to kill things. There's a really great movie called The Great Sperm Race it came out of England, and it kind of shows you what it's all about. And it uses, instead of it showing sperm through the whole thing, people represent sperm. And it kind of shows you the whole process of what a sperm has to go to actually reach the egg. And it's a feat. It's amazing. And so it's not going to get rid of the immune response the female has, but it'll help reduce it or suppress it. Now, semen also has antibiotic chemicals that help destroy some bacteria. And last but not least, it has clotting factors. Remember I said that earlier? You might have been like, this is weird. So basically, the clotting factors help to coagulate the semen initially. And this helps to prevent draining out. We don't want everything just to flow out all the time, right? And then what it's going to do is it'll liquefy it by fibrinolysin, so sperm can move. So these are the 6 characteristics of semen. And so this is where I'm going to leave it now. And the next video, we'll discuss the actual physiology.